Hey everyone, I'm Delia Savina Nabila, a Year 1 medical undergraduate from Sarvajaya University. Welcome to my video. Today, let's talk about chloramphenicol. Chloramphenicol is a broad-spectrum antibiotic which was first isolated in 1947. It was extracted from cultures of soil-dwelling gram-positive bacterium named Streptomyces venezuela. Chloramphenicol was the first antibiotic that underwent large-scale production in 1948. At that time, Bolivia and Malaysia was experiencing a typhus outbreak, and chloramphenicol was used with dramatic results to contain the outbreaks. From then on, chloramphenicol is used to treat meningitis, cholera, typhoid fever, the bubonic and septicemic plagues through oral or intravenous injections. It is also available as eye ointments in treating ocular infections caused by bacteria, such as conjunctivitis and blepharitis. Now, how does chloramphenicol work? Chloramphenicol is a type of antibiotic that inhibits the protein synthesis of bacteria, causing bacteria to lose its function. Therefore, chloramphenicol is bacteriostatic, which means it stops bacteria from growing and reproducing, but it does not necessarily kill the bacteria. Let us take a closer look at its interesting mechanism of action. Before that, I'm going to talk a little bit about protein synthesis so that we can make sense of what the drug does to the bacteria. Imagine I am attempting to cook a dish. To prepare a dish, I will need a cooking recipe, the ingredients, and my grandmother's assistance. So, inside the bacterial cell, there are ribosomes whose function is to synthesize proteins. Therefore, I act as the ribosome to produce the dish, which in this case, proteins. There will be mRNAs or messenger RNA that carry information on how to produce the proteins. They act as the cooking recipe. Amino acids carried by tRNAs or transfer RNA serve as the ingredients to produce the dish. tRNAs or transfer RNA help decode the mRNA or messenger RNA sequence into a protein by matching an mRNA codon with the amino acid it codes for. In an easier word, my grandmother is the tRNA. She decodes the cooking recipe to me by explaining the ingredients to use following the right sequence in the recipe. Finally, tada! A dish is produced. This is the protein that is synthesized by the ribosome. Now, let's look at its actual mechanism. Each ribosome has three sites: the entry site, the P site, which is the peptidyl tRNA site, and the exit site. The upper, bigger part is the 50S subunit, while the lower, smaller part is the 30S subunit. Amino acyl tRNA enters the entry site. Both tRNAs carry their own specific amino acids. An enzyme called peptidyl transferase will act as a catalyst in the formation of a peptide bond between the amino acids of these two tRNAs. Then, the ribosome moves forward along the mRNA. tRNA from the P site moves to the exit site and tRNA from the entry site moves to the P site. When the cycle continues, elongation of protein occurs. So, due to extreme lipid solubility of chloramphenicol, chloramphenicol diffuses through the bacterial cell membrane. This drug then binds to the bacterial ribosomal 50S subunit. This binding inhibits the peptidyltransferase activity, thus formation of the peptide bond cannot occur. When the peptide bond fails to form between the two adjacent amino acids of tRNAs, this stops the protein chain elongation. Therefore, protein synthesis of the bacteria does not occur. This is how chloramphenicol carries out its function as an antibiotic. Even though chloramphenicol is an effective antibiotic against many types of bacteria, it is reserved only for the treatment of life-threatening infections, such as typhoid fever. This is due to its serious side effects, especially bone marrow suppression that can result in death. The tendency for chloramphenicol to cause damage to the bone marrow often causes aplastic anemia, where the bone marrow fails to produce sufficient blood cells for the body to work normally. Chloramphenicol also causes gray baby syndrome if administered to premature infants. The infant's lack of necessary liver enzymes to metabolize this drug leads to accumulation of chloramphenicol in the infant. This leads to toxification of chloramphenicol in premature babies. That is why today, chloramphenicol is a drug that is only recommended when safer antibiotics are not available. That's all from me. Thank you so much for watching. I hope you enjoyed the video. Have a nice day.